to the First Nations Health Managers Association's weekly town hall. Over the next hour, we will provide an update on the COVID-19 pandemic and then focus on what we can do to close the 87,500-hour life expectancy gap. Join us as we speak with health professionals, subject matter experts, and Indigenous leaders. Send us your questions to fnhma@ihtoday.ca. We want to hear from you. And now your host, Marion Crowe.
Tansay from the Nation Talk studio in Toronto, home of the Mississaugas of the Credit, the Haudenosaunee, the Wendat, the Huron, and many other diverse nations. It is an honor to bring you this final episode of the First Nations Health Managers Association Town Hall. You heard that I am Marion Crowe. I hail from Treaty 4 territory, Papa First Nation. I now get to live in the beautiful, unsurrendered and unceded territory of the Algonquin people in Ottawa. Thank you for getting your credible, reliable information here on the FNHMA town halls. Most of you who have been following along will know that we stopped talking about COVID for the whole hour. We're still giving you that reliable, credible information in this final town hall. And then we're going to talk about life promotion and harm reduction, because it is a Thunderbird Partnership Foundation Town Hall takeover. I wish I had firecrackers or something just lighting up. I hope you feel the love. I hope you feel the energy, and you're sitting back with your cup of tea, ready to get some information that you can count on. So with that, I do want to give a special thank you to all of the guests that we've had over the past 60 episodes of filming this amazing information session. So I do want to call in my auntie, my sister, my mentor, my good friend, Dr. Shannon McDonald. Come on into the Crow's Nest, Shan.
Good afternoon from Squamish, Tsleil-Waututh, and Musqueam territory. It's very rainy and a little bit dark, so I'm hoping I'm not in complete shadow, but it's very, very good to see all of you. So, COVID, we've been at this for a while. A little over 2 years ago, it all started. It started in a way that people thought, well, this can't be that bad. It's just going to come and go like flu season. Well, it has now been well over 2 years, and we are facing new variants. We are facing new outbreaks. We are facing new challenges. Over the last month or so, all of the jurisdictions across the country have been changing how they respond to COVID, changing public health mandates, dropping public health orders, so people are not required to mask everywhere in indoor spaces. BC, as of the 8th, no longer requires the vaccine card or vaccine passport, depending on where you live, to get into places like restaurants and theaters. And so what's been happening? Well, to be honest, it hasn't been great. And that's the case right across the country. BC is probably doing as well as can be expected. There have been a slight increase in positive cases over the last couple of weeks, but in other places in the country, those increases have been quite significant, enough that people have started to say, maybe we need to have the kids masking when they're in school. Maybe we need to rethink some of those public health mandates and orders. And they are different right across the country. But the thing that's really important for me in our work at the First Nations Health Authority is that our communities, our nations are self-determining. And when we talk to our nations about choices that they're making to protect themselves, their nations, their communities, their families, they have to make those decisions for themselves. And we have continued to supply masks. We have continued to go back to community over and over again with vaccine. Our older folks, 60 and above, almost 90%, a little over 90% in the 90-year-olds, of people have had 2 doses and a booster. They're raring to go. And now the province is ready to offer Indigenous people 55 and older a 4th dose of vaccine. So this is new. We have had a really good relationship with our provincial health officer, and we're able to show evidence that while provincially the cases and serious illness and hospitalization is more in the 70, 80-year-old and above group and long-term care facilities and such like, in Indigenous populations, that age is less, that we are seeing more cases, more serious cases with hospitalizations, and sadly have had losses in our community among people in their 50s and 60s. So our relationship with the provincial health officer allowed us to say, no, things have to be different with First Nations. In the early stages of vaccine availability, we were able to work with the province to have an all of community approach when it came to vaccines, rather than starting with the oldest folks and going to the youngest. That didn't work, especially in our most remote and isolated communities. We couldn't keep going back and back and back. We wanted to give our nurses and our community teams the power to do that work and to lead that work for everybody in the community. And we've continued to do that. We are also worried, though, that when it comes to vaccination, not only is COVID front and center, but we're worried that everybody's been so busy vaccinating with COVID that we have children who are not getting their regular vaccinations. It's getting harder and harder to do that. So we need to think about health and wellness, not only in the context of COVID, but all the way through the life cycle and for all of those diseases that put us at risk. Living in houses where there are several generations put people at risk. The environments can put people at risk. People who are making lifestyle choices that impact their ability to make good decisions are also putting them at risk. So we want to be able to support families, support communities, and support individuals who are struggling to make the best choices that they can make for themselves to move towards wellness. We've had some challenges lately. The provincial system, we used to link with a provincial data system that allowed us to know every single status First Nations person who had been diagnosed positive COVID. We don't have that anymore. Less and less people are getting the PCR tests, so the ones that require it to go into the lab for testing. Less and less people qualify for those, so we're getting less of those results. People who use the rapid antigen test, and good on you. Good on you. If you're symptomatic and you're using those tests, it's absolutely essential that you do what you need to do to make sure that you're keeping yourself safe and other people safe, that you're isolating. If you're vaccinated, you should be isolating for at least 5 days with a positive test. If you're not vaccinated, you should be isolating for at least 10 days. But those rapid antigen tests are only a tool. What we don't have is the data from those rapid antigen tests. So we are counting on communities to be aware, to know that there is more and more cases happening in their community. If people are becoming seriously ill, that they're going for a PCR test so we can have that registered and they can qualify for medications that may help them during the symptomatic period. So there's still lots of work to do. We have new subvariants showing up. Heard this week about a new one, XE. What the heck? What we do know is that COVID is here to stay, and we have the power to keep ourselves as safely as possible in our daily lives. So where it's appropriate, choose to wear a mask. Where it's appropriate, make plans around community gatherings. We've just had the all-native basketball tournaments and hockey tournaments and big house events, making sure that there are precautions during those events, that people are using masks, hand sanitizing, doing what they can about keeping some distance between themselves. We can do this. We have survived worse before, and we will do it again. The last thing I want to say, because I am running out of time, is that partnerships are absolutely essential, and I'm very, very grateful to our federal partners, to our provincial partners, to our health authority partners, our community leadership, our families. You're the ones that are making the difference at the community level, and those partners are enabling us with the tools that are available. The other thing that I want to mention before my minute runs out is that we are battling two public health crises in BC, and one of them is the toxic drug crisis. We are losing more and more people. We are seeing younger people losing their lives to the toxic drug crisis, potential years of life lost, the magic that those people could have participated in terms of community wellness and moving forward. It's tragic. And we want everybody to be aware of what harm reduction is available in community, what supports are available in community, and taking care of each other with love and respect, and honoring individuals in their struggle, because being beside them, behind them, and walking with them in their struggle is the best way forward. So thank you.
Dr. McDonald, thank you so very much for being with us, for sharing those words of encouragement, and for reminding us of the tools we have to keep ourselves safe and protected. Thank you, Dr. McDonald. I also want to say a shout out. Thank you to Gordon, to Margaret, Andy, Albert, Melissa, Amanda, Jonah, and Vicki for getting your reliable, credible information here on the FNHMA Town Hall. For those of you that might have a question for any of our amazing Indigenous women today, you can send those questions to fnhma@ihtoday.ca. And with that, I do want to take a moment so that we can watch this beautiful message from our partners, First Peoples Wellness Circle and the Thunderbird Partnership Foundation, with the First Nations Health Managers.
There's no such thing as an old addict. You either get clean or you die. I knew I needed to stop for my kids and my grandkids. There is hope, and there is people that do care and they do love you. I learned that our culture teaches something very powerful: compassion. Through acts of kindness and compassion, we find meaning in ourselves. I found connection. When we're connected, we're never alone.
There's lots of bullying at the school that I come from. I ended up in a neck brace. I had a concussion. I got kneed in the back of the head. Sometimes things can get really bad and you think, oh, like there's no point of like being here. The support from people around you has a lot to do with the anxiety and depression. Because I'm different, a lot of people didn't understand. Through acceptance, we find belonging.
What beautiful messages to keep us inspired, lifted. And if you want to share your story, please share it on soarabovestigma.ca. And you know who's going to help keep us soaring? That is our beautiful friend and partner, Dr. Carol Hopkins, Chief Executive Officer of the Thunderbird Partnership Foundation. Carol, come on into the crow's nest, and I'm passing our virtual torch to you.
Greetings, relatives. My name is Mother Wolf, and I'm from the Wolf Clan. Lene Lenape Endau, Lenape King and Donjba. I come from the Lenape Nation, otherwise known as the Delaware people, and I'm joining you from the Delaware Nation at Moraviantown in southwestern Ontario. I have to say thanks again, Marion, for inviting us back. And today we're talking about harm reduction is life promotion. You know, we talk about these ideas of harm reduction and life promotion often in separate and different discussions. But today we're bringing both ideas together, and we're talking about them together because they both help us to think about how we ensure life all around us, amongst our relatives, and in our communities. These town halls have been telling us, and we know from research that shows on average, Indigenous people live 10 years less, or 87,500 fewer hours than non-Indigenous Canadians. That's a huge gap that we have to work together to close and to address. So harm reduction and life promotion can help. Most people think about those two things in different circles, as I said. And we think about life promotion often as connected to suicide prevention. And today, I want to ask you to expand your thinking about life promotion and create an opening through curiosity. Through your curiosity, what does life promotion have to do with harm reduction? I want you to think about that. That's what our show is about today. And I'll give you a hint. Life promotion is harm reduction, and vice versa. Harm reduction is life promotion. So I want you to think more about that. When I think about harm reduction, I think about honoring the sacred breath of life that has been given to us by the Great Spirit. Some of you might refer to that higher power as God. Some of you might refer to that person or that entity as the Creator. That's where our breath of life comes from, the ability to breathe and to continue living life. It's a sacred, spirit-endowed breath of life. And we want to raise an awareness about our collective responsibility to support that breath of life, especially for people who use drugs, who have the right to continue to live life. We're not talking about forcing people to make decisions around abstinence. We have no right. We have no moral right, no legal right, and we have no spiritual right to tell people how to be well. But we do have responsibility for supporting each other. That's central to our values as First Nations people, is that connection and relationship that we have with each other and all of life. So we want to help each other to understand, what do we do to act upon that spiritual responsibility to protect the sacred breath of life? And if we do that, we're supporting a reduction in harm to people who use drugs, including their families, including the communities where they live. And we increase safety from toxic drugs that Dr. Shannon McDonald talked about. And we increase safety around alcohol use and other related harms of substance use. We can't judge that. We can't judge, but we can make ourselves aware, and we can begin to develop an understanding. What's my role in all of this? Well, harm reduction is about ensuring life. It is life promotion without stigma, and it's without judgment. So that could be helping people who use drugs and alcohol get connected to life, life-giving things, life-sustaining things like their identity, being connected to the land that they come from, getting connected to natural medicines, and ensuring they have good, safe, sterile supplies so that they continue living. And so challenging, stigma with educating people that words that we use matter. They matter because they can shame and blame people, and we don't want to do that. We don't want to further isolate people and increase their risk of harm. And so I invite you to listen closely to the incredible messages that you're going to hear around life promotion and harm reduction. And so I'm going to invite Leah. Thank you so much for joining us today in the town hall. I look forward to your incredible message. Leah is from Kilala Lelum, and they're blazing trails when it comes to decolonizing and groundbreaking healthcare in cultural ways. Miigwech. Over to you, Leah.
Oh, hi, Chika. Carol, it's such an honor to be here with all of you. It's such a privilege to do this work. I'm speaking to you from the unceded lands of the Musqueam, Squamish, and Tsleil-Waututh, and I'm grateful every day to be here, to be able to listen to the teachings of this land and the elders and knowledge keepers of this land that have gifted us with our knowledge. I identify as Nakatma. My father was Nakatma and English, and I have kinship ties and responsibilities at Seabird Island. I also have Danish ancestry from my mother. I'm a mother and a wife, and I've spent the last 20 years or so in Indigenous health. Most of that was at UBC, and I worked in curriculum development and worked in the Faculty of Medicine to support our community members. To support healthcare providers in being with our communities in good, culturally safe ways. It was an incredible privilege. And now I've been doing community work, and I'm so privileged to be the executive director of the Urban Indigenous Health and Healing Cooperative, which is also Kilala Lelum, and that's the name that was gifted to us from our elders, from our host elders here. And Kilala Lelum means butterfly house. And butterfly house, it's such an appropriate name if you think about it, right? It's, if you think about the egg and the caterpillar and the pupa, and then into the flight of the butterfly, that transformation that can happen when you're taken care of. It's amazing. So I think it's such a beautiful name. Our clinic here is in the downtown east side of Vancouver. And I know that lots of you know lots of things about Vancouver's east side. I think there is so much resilience here. And I also call it the epicenter of colonial harm. I see here, that's of course because of colonial policies, because of racism, because of residential schools, because of Indian hospitals, because of the 60 Scoop, because of all of the policies that have harmed our people. And many from all across Turtle Island and British Columbia have come and found their way sometimes here, particularly if they've experienced intergenerational colonial harm, right? It becomes part of the fabric here, as well as the resilience. So this place, we have now like almost 80 staff, and it came to be as an answer to, knowing that the primary care healthcare system wasn't enough. We've had a report in BC, it's called In Plain Sight, that really is a response to what was happening to our peoples and our communities with the healthcare system. And the healthcare system, of course, is racist and causes harm to our people. Ours was a response to that, and the Truth and Reconciliation Commission, and people coming together with the idea that we can create mental, emotional, spiritual wellness for people in one place. How do we do that? How do we do that in one place? Well, by transforming the primary care system to include knowledge keepers and elders. So Indigenous medicines, two-eyed seeing, coming together with what we want to create here. So this was originally an experiment a few years ago at a site where they brought elders together and primary care providers. And they found that involving elders and cultural wellness in the program, there was a 50% reduction in suicide ideation and emergency room visits. So that's in the literature. So knowing that culture and cultural identity that we get to experience in the presence of elders makes a huge difference to our health and well-being. So our model is based on that. And, oh my gosh, I think I feel like I'm speaking too slowly. I really wanted to say that we work really hard to decolonize our space, think about the systems that create harm. So it goes to everything that we do around circle building, around how we see people, how we welcome people at the door. Knowing that our people have experienced so much harm, how do we welcome them at the door? How do we have medicine at the entrance? How do we have elders at the entrance? How do we include all of those things? How do we have food as medicine? That, of course, we know that for our people, food is medicine. So there's food. We feed lots of people, but there's food even in the elders room. We know that that's an offering that we can have. We have a recent grant from Health Canada in the last 2 years, and it's specific to addressing the toxic drug supply. And our partnership, we wanted to see if our partnership with elders could actually reduce the harm. So it's really critical here. It was scary. I have to be honest, this journey is a little bit scary. There's fear. You kind of go, oh my gosh, we are actually going to offer access to injections. We're going to answer with safe supply to people. For those of us that haven't had a lot of experience, it was terrifying. And as a collective, we all sat together to learn together about how important it is to support people on their journeys. And we know that offering safe supply helps people live. We know that that elder or that young person coming through the door, if they're seeking help for them, we can help them with medicines and connecting to family, resources, culture. If they're ready on their next step, it gives them a little bit more time. It reduces their exposure to infections, reduces their exposure to poverty, to destruction of relationships. All of those things happen from the toxic drug supply. And I can't help but think how much better things could be if we all adopted that message. So I guess my final message is, or a message to you is this: you can't do it alone at all. We have to do it together. So that's important. And coming together to educate yourself as a community and as a family really helps so that you can respond in a good way. Yeah, that's all I have to say. Hajko CM, thank you.
Thank you so much, Leah, for sharing your journey and for the incredible courage of the team and your partners to walk through that fear, not getting stuck there based on your own emotions, but facilitating a way through to ensure, again, that sacred breath of life. So thank you so much for sharing. If anyone has questions for Leah, she's going to stay on with us for questions and answers later in the program. And we heard Leah talk about the critical role of culture and elders. So I want to invite Elder Betty Clayton to join us, and she's going to share with us about her work and the cultural teachings and knowledge that she passes on to support people in living life well. Miigwech.
Thank you so much, Dr. Carol. Thank you for inviting me on your program. I would like to acknowledge that we work and live and play on unceded territories of Musqueam, Squamish, and Tsleil-Waututh people. I would like to introduce myself, my traditional name, which is Wee Luke Gidolfgam, which English translation means the big sunset. I am a matriarch from the Tsimshian and Nisga'a Nation. I've been working with Kilala Lelum in many separate programs. The first one being the maternity team, where I work with midwives, doulas, and expectant mothers. I also work half-time at in-house support. I also work on a team with other staff members that have the most amazing, unique spiritual and cultural gifts. And I'm very to be part of that team. I find that I work not only on the maternity team, but with the in-house support work. I find that 9.9% of our members walking in through our front doors are dealing with some sort of intergenerational trauma from residential schools, 60 schools, and foster care. This trauma affects a person's whole life. It affects them. Emotional referrals come to me through our doctors, our nurses, the research team, different programs at our agency. I had the privilege of training our staff on medical teachings as our doctors and nurses had to realize that the mental health and the medical issues our clients are dealing with is not just about Western philosophy. It's not just about Western medications and writing out a prescription. It's about balancing a person, restoring their spirituality and culture. And this is where myself and my team come in. I find that by using the medicine wheel teachings that's showing on your screen right now, because I was trained at the Nietzsche Institute quite some years ago. And what I had to first do at the Nietzsche Institute was heal myself first, so I could understand this training and be able to use this training on people I came in contact with. This medicine wheel teaching is medicine. And so what I'm going to do is walk you through the 4 colors of the medicine wheel. As you see, they're red, black, yellow, and white. And I'm going to talk about the first quadrant, which is red. And I had these medicine wheel flip charts professionally made quite some years ago, because I noticed there was a disconnect between our teachings from our Western culture. Nobody was seeming to understand or want to know about what can we provide cultural teachings. So I had these medicine wheel teaching flip charts professionally laminated, and I travel everywhere doing this training so people could understand it and they could start using it. So in the truth telling, in the emotional part, is usually on fire, because people are dealing with, when they tell their story, it's going to be some form of intergenerational trauma. It's going to talk about the fear, the grieving, the trauma, the hurt and pain, the suffering that they've been enduring, not just for one day or 1 week. We're talking year after year, generations of this abuse within the family. And so when you see this type of trauma going on, it affects the next quadrant, which is black. It's the physical quadrant. It affects it, and we have to acknowledge what it's done, what this intergenerational trauma has done to a person's physical body. We're seeing generations of it, why people are stuck in cycles of addiction, cycles of poverty, cycles of abuse, cycles of relationship breakup, suicides, why so many people are incarcerated, why we see such early death, why we see the increase of homelessness. And once they understand what has happened here in these first two quadrants, why people can get stuck there for generation after generation after 100 years of residential school trauma. And that's horrifying. That hurts me. It hurts me so much. And I do this training because people have to understand this is why we're seeing early death. This is why we're seeing multiple generations of extreme poverty. And I do this sort of teaching, especially on residential school, because even though I did not go to residential school myself, my husband did his whole life, his whole childhood, and his whole teen years. And I could get emotional just talking about that. But I had to learn. I forced myself to learn about it, because being the matriarch of my family, I had to train our 4 sons, our 7 grandchildren. I had to train all my family members. It was so important. They had to understand this. And so now we're seeing a way to get them unstuck is by bringing them over to the yellow, which is spiritual and cultural. So if I can come in and do it and let them vent with me, let go, release that tension, tell your story. Every person's story deserves to be told, and it has to be. So while they're telling their story, I'm lighting my smudging. I carry medicine. And I do a smudging ceremony with every single one of my clients. And this startles a person, because now they're right back in their own culture, their spirituality, and they absolutely adore this. So now we go up to the mental part, where we're going to start putting in treatment center, addictions, counselors, parenting programs, you name it. And so this smudging and medicine wheel teaching is medicine. And so what a person does to get back on a healing journey is learning how to forgive yourself for what you put yourself through. It wasn't your fault. It was not your fault. And so by doing ceremony with them and prayer is all part of a safety plan to address harm reduction and life promotion. We get to this stage where now we're doing ceremony with them. They're understanding how they got stuck, how bringing them to the culture and spirituality has now restored their spirit. They're now restored their spirit, and they're ready to do the work on themselves. It's an amazing process to witness. I see this with the women I work with on the maternity team. I see it one-on-one with the clients that come into my office, how our clients want a different change in their life. They want a better future. So they continue to come back to our office, and I'm so grateful for this. They want the ceremonies, they want the prayer, they want to meet with somebody that's going to listen to their story. So I am so honored to be working at Kilala Lelum, where we use our medicines, use our ceremonies to help our clients and to help promote their life. This is a life promotion by using harm reduction, spirituality, and culture. I thank you so much for allowing me to present this. All my relations.
I hold my hands up to you, Elder Betty. Thank you so much for bringing together our own medicines, our own way of knowing, and our cultural practices to support people who are struggling through life, finding their way through your programs and services, through inviting them in. I just have that really beautiful image of people at the door inviting people in to a space that looks like them, that belongs to them, where they can be part of a community and feel welcome. Thank you so much for your words and for your teachings. For those of you who are joining us today, just remember that Leah and Elder Betty are going to be here for questions and answers, and you can send your questions to questions@ihtoday.ca. We've got the questions and answers coming up, but first we're going to show a short video. And it's a video that talks about wellness on the land. And it represents a service delivery model that Thunderbird created along with our partners. It's about connecting to land. From a national First Nations methamphetamine and opioid survey, we know that people who do not have a connection or belief in their culture and their own Indigenous identity, or who do not have a connection to someone that they can depend on, a mentor, someone who can be there to help them navigate life. When you don't have culture and you don't have relationships, 5 times more likely to be using methamphetamine or opioids in a harmful way. And so land makes a difference, culture makes a difference, relationships make a difference. Let's watch this short video.
Wellness on the land is the focus of many resources developed by Thunderbird Partnership Foundation. We know that one of the best ways we can support wellness, whether it's for harm reduction services or life promotion programs, is by reconnecting with the land. Throughout the pandemic, many First Nations treatment centers across the country have continued to provide substance use and addiction services in person when possible, or through virtual and telephone counseling sessions. What they've also been doing is operating and developing more land-based healing programs. Through a tool developed by Thunderbird called the Native Wellness Assessment, treatment centers have shown the true power of that land connection in real numbers. Since its inception in 2015, the Native Wellness Assessment has shown that time spent on the land boosts our wellness and sense of belonging by more than 20%. That happens every time you go hunting, fishing, gathering medicines or tanning hides, or just going for a walk. A land connection nurtures that good feeling of belonging, so critical to supporting our overall wellness. This connection to land also helps foster healthy habits. When people have a stronger connection to culture and community, they are less likely to use drugs. Life promotion, which is all about ways to support life, encourages people to strengthen their connection to land, community, self, and spirit. All this equips them to live a long and prosperous life. As you look at these images of the land, think about times you enjoyed being there. Maybe it was in the sugar bush, on top of a mountain, on the water, or in your local park. Think about the time when you had that aha moment, when you really felt connected to that space. You thought about your relationships. Maybe you thought about your ancestors and how they lived with the land. Maybe it's a place where you felt safe enough to be who you are. These are the same connections treatment centers facilitate to support healing and wellness. These connections are about our relationships to the land, ourselves, our families, communities, and ancestors. Harm reduction and life promotion are a way of life, Minnow Bamadswin, the good life. And a good life is built through belonging and relationship.
such another beautiful remembrance of getting back to the land, connecting with our kinship on the land, and that just made me so homesick for Treaty 4 territory, I have to say. But let's dive right into our question box after I get an opportunity to lift these amazing women up. Let's get them all up on this screen. Dr. Shannon McDonald, Leah, Elder Betty, Carol, we all rise and stand with you and lift you up. Oh, such a powerful and impactful show. Elder Betty, I want to call you back into the crow's nest for a moment because there is a question for you from the inbox, Elder Betty, and we're curious if you wouldn't mind sharing with us, how do you and your other elders look at the evolution of street drugs, and how do you keep up with some of the pressures associated with, say, for example, the opioid crisis? What does that look like to you as an elder, Betty?
Thank you for asking that important question. And I find that the programs that we run at our agency, we have weekly group staff meetings in our Hummingbird room where our doctors, our nurses come in and give us updates of what's out there, what's being distributed, what is the harm, what are the bad batches of drugs coming in. And so we're aware of this all the time. And I'm so relieved that our doctors and nurses, our research team, the referrals coming from different programs, they're aware of what our clients are going through. And so even though they are on, prescription drug, could be temporary, could be, I don't know. I don't judge them. I welcome them into my office, even if I have to carry them on my shoulder. I see the people waiting in our waiting room, and I take them into my office and we will have a ceremony, and I let them cry. I let them do everything. And now is the time to be honest. They have to be honest with what's going on. And if they're ready, we are there ready with them also to promote wellness, to have our resources ready, our supports ready. It isn't anything to fear. When our clients come in, they come on a level, we have to bring them to a level of acceptance. And they see this when I do the medicine wheel teachings with them. And I love seeing this, their aha moment they have when they see it on the wheel, when they hear it in our prayer, when I just repeat back the story they told me, except now I'm asking the Creator to take over for me, to remove this sickness, to restore their spirituality, restore their culture. And it's the most amazing process. And everybody's so different. So nothing is harmful, nothing is worrisome. It's all spiritual and it's all cultural. And I'm so thankful to be able to do this work. I hope that has given some sort of answer to your question.
Elder Betty, such wise words to share with our listeners, our viewers, and just a personal thank you for your commitment in harm reduction. You're gonna make me cry now, but let's save the tears for another day. Don't want to have my face dripping down my white blazer. So thank you for laughing with me.
Because I do get emotional, and I have this best support system, but because it's spiritual and culture, and I don't know any other way to walk in this life. My life is spirituality and culture. And so this is what helps me a lot, despite the fact I get emotional a lot.
Well, thank you for bringing that emotion and that commitment with you. Carol, come back into the crow's nest. I have a question for you. One of our viewers is asking, how do we start harm reduction activities in our nation? What would be some steps to take to undertake more wellness?
Well, the most immediate thing that we can do is to educate ourselves, inform ourselves, so that we don't go and start asking a lot of questions and place all of the responsibility on someone else to take care of our learning. Do the learning yourself. There's lots of resources out there on stigma-free language. Don't use the word drug abuser, user, and all of those kinds of negative, they imply negative things about people. We replace their First Nations identity with the identity of a behavior. That's not our way. We are First Nations people. We will always be First Nations people, no matter how we behave. So it's always people first in our language. People who use drugs, people who need relationships and connections. So that's the next thing. When you educate yourself, is go out and make a connection. A smile, a nod, a greeting is so meaningful and important. To see people and validate their presence and their existence. A simple act of kindness is really important. And then offering, in the community, if you have availability of resources, people are hungry. They need food. Sometimes our food support programs in our communities, they have way too many barriers. We want to ask all kinds of questions to understand that population. That's none of our business. People just need food. Create barrier-free access to food so that they can continue living life. Some communities, they provide safe spaces, and safe spaces where they can sleep with safety. Sleep is so important for our well-being, and people need safe places to sleep, to escape the harsh weather conditions, no matter where they are. So if there's spaces that we can create in our community, our cabins out on the land, they're important for making sure people have a place of belonging. We have to attend to the very basic physical needs: food, shelter, clothing, and relationship and connection. Acknowledge people as First Nations people. They're your relatives. We're all related. The Great Spirit put us here on this land, and because of that, we're all related. We have to get rid of that colonized thinking where we place people in different buckets, and you're the people that we can just throw away. We can't throw away anybody. Again, we don't have that teaching in all of our teachings and sacred societies. There's nothing that says we have the right to judge and discard. We can't do that. We have to establish connection and relationships. So those very simple things are a good start. And then, like I said, make sure people have safe equipment for using drugs. It will also increase safety for the rest of the community. You don't want discarded needles in the bush by the ball diamond or in the park down the road. You don't want that in your community. It creates risk in the community. So provide a safe place for people to get access to sterile, clean equipment, and create a safe place for them to pick that up and to discard it. Simple activities. Use your language. Connect to people through your language. I said, when I started, Wewena Bojo. Wewena Bojo is the original man that was lowered to the original human being that was lowered to this earth from the Great Spirit. And we are all related to that original being. Every one of our cultures talk about, in our stories of creation, talk about that original human being that we're all related to. Just that word connects us. Wewena Bojo. And then I said, all my relatives. The belief is that we're all related. So I offer just those simple kinds of things. Use strength-based language. Use language that communicates, I believe in you. I'm thankful for what you do. I'm thankful for the courage that you have. And I want to say thank you for that courage.
Thank you, Carol, for partnering with the First Nations Health Managers Association in bringing these messages. It has been an honor. It's been carried with humility and humbleness that you, our viewers and listeners, came here to the FNHMA town halls to get your reliable, credible information created by us and for us in a safe place for two-way dialogue. And in the words of our former APTN National Chief, Perry Bellegarde, this show has saved lives. I'm emotional. It's our last episode, and I want to just say a huge thank you to you, to everyone keeping everyone safely in our nations. I want to say thank you to our Indigenous Services Canada partners for making this two-way dialogue viable. I want to thank Dawn, Stella, Chris, Jason, Farshad, MJ, Morgan for doing the transcription, Pascal, merci beaucoup for doing the French, and to all the guests who helped us co-create this content. Keep staying safe, and we will see you November 1, 2, and 3 in Victoria for the National Conference of Health Leaders. Hi.